Does your back hurt playing pickleball? Then this video is for you. Hey guys, Phil here, Doctor of Physical Therapy. Today I want to show you 5 stretches and mobility drills that we use often to address lower back pain. I'm in my car again. I'm realizing this car thing works pretty good, so I'm going to try to do this again. As a physical therapist and an avid pickleball player, lower back pain is one of the most common injuries that occur because in pickleball you're spending a lot of time hunched over, bending over, especially at the kitchen line. So basically what I want to do today is to give you guys something really tangible and something that you can do when you tweak your lower back. But first, I do want to mention that lower back injuries are complicated and there's no one size fits all kind of solution to it. I think lower back pain in general costs the US healthcare system hundreds of millions of dollars a year or something like that. You can fact check me later. The causes of lower back pain is kind of different depending on what you're doing, right? With something like pickleball, it's oftentimes like a capacity issue. Maybe you spent too much time hunched over at the kitchen line. It's a different mechanism of injury compared to something like deadlifting at the gym, where you picked up something heavy or anything like that. As a result, a pickleball related lower back injury tends to be less serious, less traumatic, right? Because you're not doing anything too crazy. Of course, it's a case by case basis, right? Some people might have a history of lower back injuries, and pickleball is the thing that kind of re-aggravated it. But before we get into it, I do want to set some guidelines that if something hurts, don't push into it. Listen to your body. Conversely, if something is relieving and feels productive, hold it for a little longer, just to kind of relax the muscles and relax the tension in that area. And with all these movements, you want to breathe into it and relax into it. And we're shooting roughly around 5 to 10 repetitions of each. If a stretch feels unproductive, what you can do is decrease the range of motion. So say a stretch hurts when you stretch all the way, don't go all the way, just go maybe halfway or before it starts to hurt. So the first one is called a cat-cow. This is one of the classic movements in yoga. It's one of the best because you are relaxing your whole back by extending it and arching and by flexing and rounding your back. You can do this on the ground or in the bed. The idea is we're getting some nice fluid motion through the lower back by rounding and extending. And you want to just spend some time doing each movement nice and easy. Again, this is more of a mobility drill, so this is not something you want to rush through. It's something that you just want to kind of move through, hold it for like a second or two, breathe, and then move into the other position. And next we have the rock back. So right from that hands and knees position, you can slowly rock your hips back to your heels. This way you're going to stretch out your hips a little bit more. You're going to get your lower back bending a little bit more. Sometimes some people find it more comfortable if you kind of open your knees wider a little bit as you're rocking back. Especially with lower back strains or kind of muscle tension, this is really good to just kind of stretch out that lower back. Again, feel free to spend some more time in that stretch position, especially if it feels productive. So go back into the stretch, you come out of it and go in again. Next, we have something that's called thread the needle. You're going to get back into all fours, hands and knees. You're going to reach across with your arm, reach under, try to really get your shoulder to the ground. So you're going to turn your back, turn your head, reach under, and then return to the original position. Open up your arm, reaching for the sky, just to stretch out that mid back, your chest, your shoulders. It's really good just to get some motion through that whole spine there. Smooth motion, open and close. You can do a 5 to 10 on each side. So next we have the open book. You're going to get onto your side. It doesn't matter which side because we'll do both sides. You're going to lay on your side, straighten your bottom leg, bend your top leg, and you're going to hold on to the knee of your top leg just to keep it on the ground. And then you're going to roll across with your upper body, eyes following your hand, turning your whole upper body. That way you should get a nice big stretch in the lower back. Sometimes this can feel a little bit aggressive, so ease into it. Again, don't push into anything that hurts or anything that feels like it's triggering symptoms, but keep it comfortable. So with open book, you're going to want to do both sides as well. So once you're done with one side, flip over, do the same thing on the other side. And lastly, we have the figure 4 stretch. This one targets your hips a little bit more and it's going to get your hips as well as that lower back region. So you want to lie on your back, cross one leg over the other, and you want to slowly roll your hips and bring your knee down to one side and then swing back and down the other side. So it's nice back and forth swaying. Again, keep it moving, keep it comfortable. Don't push into anything too uncomfortable or painful. And once you're done with one side, you're going to switch on to the other side. So that's it. Simple enough, right? So all 5 of these movements are kind of our bread and butter in physical therapy. We give these out a lot, especially to patients with lower back pain. These are a great way to help loosen things up, especially if things feel tight or achy in that initial phase. You want to teach your body to slowly stretch out. And of course, this is not a fix to all lower back pain. This is just a recommendation for improving flexibility and mobility of the lower back. In order for us to prevent injury again or to reduce the risk of injury, we really have to look at strengthening and smart training, right? We don't want to constantly be overloading our lower backs. And we also definitely want to strengthen the core, the hips, your legs. All these things play a huge role in reducing the risk of injury to your lower back. In this video, I do want to just focus on the flexibility and the mobility portion mostly. I think in the future I'll post a more strengthening oriented lower back guide, which would be more focused on prevention. If you guys liked the video, feel free to give me a follow. Stay healthy. Take care.